Welcome back. In today's session, we are going to discuss about whooping cough. It is a continuation to the chapter Epidemiology of Communicable Diseases. Whooping cough is also known as pertussis. It is an acute infectious disease seen in the young children. So the other name of whooping cough is pertussis. Okay? Pertussis. It is an acute, highly contagious, infectious, contagious disease seen in the young children. Okay, moving further to the definition of whooping cough. Pertussis or whooping cough, it is an acute, highly contagious disease. It is contagious. It spreads from one person to another. So it comes under the infectious diseases. It is an infectious disease, contagious disease, which is causing classic paroxysms of uncontrollable coughing. So what does pertussis cough? It produces classic paroxysms of uncontrollable coughing that is violent and persistent, followed by a sharp high pitched intake of the air, and this sharp high pitched intake of the air is responsible for the production of the characteristic woof sound. So let us define whooping cough more clearly. What is whooping cough? It is highly contagious or infectious disease. It is characterized by paroxysms. So there are continuous paroxysms, and these paroxysms are classic. They are uncontrollable coughing. They are classic paroxysms of uncontrollable coughing followed by a sharp high pitched sound. Okay, and these paroxysms of violent coughing, they are violent, they are persistent coughing followed by a sharp high pitched intake of the air. Okay, there is a sharp high pitch intake of air, and this sharp high pitch intake of air is producing the characteristic woof. I hope the definition is very clear. Okay, so let's just discard this. Yeah, fine. Moving further, it is clinically characterized by the insidious onset with a mild fever. How does the whooping cough present itself? So the clinical presentation is, it starts with the insidious onset of mild fever and irritating cough. The irritating cough gradually becomes classic paroxysmal cough with a characteristic woof. How is the classic paroxysms of cough? It is an uncontrollable cough which is violent, it is persistent, and it is followed by a sharp high pitch intake of air producing a woof. It is also characterized with cyanosis and vomiting. Often it is referred to as 100-day cough. Since the cough is persistent one, we characterize it as a 100-day cough. Moving further to the epidemiology of communicable disease, that is whooping cough. So under the epidemiology of whooping cough, we see that in 2016, 1.39 lakh cases were reported by the World Health Organization globally, when the DPT immunization has covered about 86% all around the globe. When the immunization coverage was 86%, the number of cases recorded were 1.39 lakhs. We see that pertussis is an important cause of the death in the infants worldwide, and it is continuing to be a very important public health concern. Even in the countries where there is a high vaccination coverage, we see that even though the vaccination coverage is good, it is still a public health concern. It is one of the most lethal diseases of the infants and the lethal disease of the children who have not been immunized. It is one of the cause for the death, particularly those children who are malnourished or they are suffering with the respiratory infections. In such children, whooping cough is a lethal disease. In India, after the launch of the immunization program, the reported cases are dropping down from 1.63 lakhs in 1987. It has dropped down to 23,779 cases in 2017. It is showing a decline of 85%. We see 1.63 lakhs. The cases were reported to be 1.63 lakhs in 1987, dropped down straight to 23,779 cases in 2017. Recently, the disease is showing an increased incidence, especially in the older children, adolescents, and adults. So, generally, we see that it is a important cause of the death in the infants and the children less than 5 years of age. But recently, the incidence is also seen in adolescents, adults, and older children. According to the Centers for Disease Control and Prevention, CDC stands for Disease Control and Prevention, there is an approximately estimated 24.1 million cases of whooping cough and about 1,60,700 deaths in the children younger than 5 years of age annually. So, according to the reports of Centers for Disease Control and Prevention, according to the CDC, there is 24.1 million cases of whooping cough. They have and also 1,60,700 deaths in the children less than 5 years of age. This is all about the epidemiology of whooping cough. Moving further to the agent factor, host factor, and environmental factor, which is nothing but the epidemiological determinants. So let us begin with the agent factor. Can you guess what is the agent which is causing the pertussis? Any idea? If you know the agent, put it down in the comment section. Now we'll move further with the agent factor. The causative agent in the large proportion of the cases is Bordetella pertussis. Bordetella pertussis is the causative factor in the large proportion of the cases. In a small percentage of the cases, which is less than 5%, we see that Bordetella parapertussis is probably responsible for causing pertussis. We see Bordetella pertussis and parapertussis. Bordetella parapertussis. The pertussis you can remember. It is caused by pertussis. The agent factor, what you have to remember, the word is Bordetella. Bordetella pertussis and Bordetella parapertussis. Parapertussis. So this is the causative agent. And in 5%, it is less than 5%, it is Bordetella parapertussis. Most of the cases, large proportion of the cases is by Bordetella. Moving further, the viruses. Certain viruses we have. Examples are given here. Adenovirus, parainfluenza virus. These are also implicated in the whooping cough syndrome. But their presence in cases of whooping cough is coincidental, or it is not casual. It's just a coincidental appearance of these viruses in the causative factor. So we see a picture of the Bordetella pertussis, which is producing the whooping cough. Bordetella pertussis, where does it occur? Now moving further to the appearance of Bordetella pertussis. Bordetella pertussis can occur either in smooth or rough faces, capsulated and non-capsulated forms. We see Bordetella pertussis. What are the types? It can occur either in a capsulated form or non-capsulated. Okay, the types is capsulated and non-capsulated forms, and elaborates a exotoxin and endotoxin. So Bordetella pertussis is producing exotoxins as well as endotoxins. It is a gram-negative bacteria. Moving further to the source of infection, or first let us discuss about, The infective material. The infective material is the nasopharyngeal and bronchial secretion, and also the objects which are contaminated by these nasopharyngeal and bronchial secretions also cause the infection. So the fomites are the objects which are contaminated by the secretions of an infected person. So these objects which are contaminated by the infective material, the discharges, nasopharyngeal discharge, bronchial discharges, they can cause the infection. Moving further to the mode of transmission, it spreads mainly by droplets and also by the direct contact. So we see that Bordetella pertussis, it spreads mainly by the direct contact and droplet infection. It spreads in the air. Moving further to the incubation period of pertussis or whooping cough is usually 5 to 10 days, but it is not more than 3 weeks. It takes about 5 to 10 days for the patient to develop the clinical signs and symptoms. So the incubation period, that is the moment the person got infected to the appearance of signs and symptoms. Let me just write it down here. So this person got infected, okay, from the day of infection to the appearance. So he started with the discharges, so the appearance of the signs and symptoms, that period is the incubation period. From the time of infection to the appearance of signs and symptoms in a patient. In pertussis, it takes up to 5 to 10 days for the person to come up with the signs and symptoms. So the incubation period, the time required for the infection to set up is 5 to 10 days, but it is not more than 3 weeks. Moving further to the host factor and environmental factor. Environmental factor, with the picture you can guess, it is more commonly seen in the winter months. So we see the host factor. The age. Whooping cough is primarily the disease of infants and the preschool children, the children of age 1 to 5 years. So it is seen in infants and children belonging to the preschool period. The highest incidence is found below the age of 5 years. The median age of infection is between 20 to 30 months. Very clear with the age, it is commonly a lethal disease. It is a fatal disease of the infants, of the children who are less than 5 years of age, the preschool children less than 5 years of age, and the median age is 20 to 30 months. Moving further to the sex, incidence and fatality is observed to be more among the female than the male children. So the case fatality, the number of deaths reported because of that particular disease, that is whooping cough, the case fatality of whooping cough is recorded to be more among the females, and also the incidence of disease, the occurrence of fresh cases and old cases, when we calculate together, the incidence is more seen in cases of females than the males. Then comes the immunity. Infants are more susceptible for infection from birth because the maternal antibodies are not giving enough protection. As a result, the secondary attacks may be mild. Okay, so we see that infants are more affected because these maternal antibodies, which the infants derive from the mother's milk, they are not very effective, they are not giving enough protection. As a result, secondary attacks may occur, and which will be mild. Moving further to the environmental factors, pertussis occurs throughout the year, but the disease shows seasonal trends. We see pertussis is more common during the winter months and also the spring month. The risk of exposure is greater in the lower social classes who are living in the overcrowded conditions than the well-to-do groups. We see people living in the overcrowded conditions in the slums. So what happens? They will be infected more because of the air spread. The whooping cough is a respiratory tract infection, and it is causing the mode of transmission is droplet infection. It spreads through the air. So in the overcrowded condition, if one person is affected, the others being affected are at a greater chance. Now we move further to the pathophysiology of whooping cough. The causative agent, which is the Bordetella pertussis and Bordetella parapertussis, are liberating a number of antigens and toxins. So, what do they do? This Bordetella pertussis is producing a local infection. So it is not invasive. It is producing a lot number of antigens and toxins, and these toxins will start to multiply on the surface epithelium of the respiratory tract, and they produce the pathological changes in the respiratory tract. So we see they start multiplying on the surface epithelium and they produce pathological changes. What are the changes? That is the inflammation of the mucosa, and the secretions will start to appear. Local epithelial damage occurs and there is a patchy necrosis. Tenacious mucopurulent exudate appears. Tenacious is a very adhering mucopurulent discharges can be seen, and they produce the bronchial obstruction, atelectasis, and bronchiectasis, thereby resulting in the pertussis disease. So let us understand in more detail. You can see here the inhalation of the aerosol droplets. So this person is inhaling the aerosol droplets which are containing the Bordetella pertussis. This droplet is having the Bordetella pertussis in it, and the person inhaled it. Bacterial attachment is to the ciliated airway epithelium, and this bacteria will go and attach to the cilia which is present in the respiratory tract and produces the various toxins and antigens. It is non-invasive, so it is releasing the toxins and antigens. Okay, it is attaching to the cilia, producing the toxins and antigens, and then the bacterial multiplication occurs. Bacterial multiplication, then comes the influx of neutrophils which are causing a damage to the ciliated epithelium by TCT and LPS, and then there is mucus hypersecretion as well. Okay, so you can see here the multiplication and damage to the cilia, and resulting in the mucus production, excessive secretions. So this is resulting in, initially, what does it cause? In the first place, it is causing bronchial obstruction. So in because of the increased secretion, excessive mucus production, so there is inflammation, patchy necrosis, hypersecretion, mucus hypersecretion, tenacious mucus. You can see here tenacious mucopurulent exudate which is causing a bronchial obstruction. So here you can see here, this is a normal bronchial tube which is lined with a thin layer of mucus. Here in whenever there is a bronchial obstruction, the bronchial tube with bronchitis, there is increased amount of the mucus. The mucopurulent discharges are blocking the airway. Next comes atelectasis. Atelectasis is a condition where the part of a lung or the entire lung collapses or it is failing to inflate. You can see here, because of the patchy necrosis, the damage, everything happening there, there is a collapse of the lung, patchy collapse of the lung, or the entire lung can get collapsed. Then comes bronchiectasis. So bronchiectasis is nothing but the abnormal or irreversible dilatation of the bronchi and the bronchioles when it is more than 2 mm in diameter, which is developing secondarily to the inflammatory weakening of the bronchial walls. We see the permanent, abnormal, irreversible dilatation of the bronchi in cases of bronchiectasis. You can see the normal mucus with the normal cilia. Here, whenever there is whooping cough, the excess mucus is produced and there is a damage to the cilia by the Bordetella pertussis. So the bacteria Bordetella pertussis, which is causing the whooping cough, it is damaging the cilia which is lining the airways. You need to be very clear. What does it do? It will damage the cilia which is lining the airways, causing the airways to undergo inflammation, and they produce the mucus. This mucus will start building up and making it very difficult to breathe. Okay, obviously it is causing an obstruction, making it difficult for the patient to breathe. Are you clear with the pathophysiology? Now let us come back again The causative agent, Bordetella pertussis, Bordetella parapertussis, what do? They will liberate antigens and toxins. We saw that they will liberate the antigens and toxins which will adhere to the cilia and cause a damage to the cilia of the respiratory. They'll produce the local multiplication occurs and causing a damage to the cilia of the respiratory epithelium. And the pathological changes will occur in the respiratory tract. What pathological changes? That is the inflammation of the mucosa, which is producing the excessive mucus, and local epithelial damage, patchy necrosis, and producing a tenacious mucopurulent discharge. We saw the picture very clearly. The mucopurulent discharges, exudates, and that is leading to the bronchial obstruction, where there was complete obstruction because of the excessive mucus production. And then we see atelectasis. What is atelectasis? A part of the lung is collapsing because of the excessive damage and inflammation, mucus, neutrophils will come in. So all of that is happening and there is a damage to the lungs, atelectasis. And bronchiectasis, where there is a permanent irreversible dilatation of the bronchioles, okay, because of the tenacious exudative discharges and the pathology which is happening there. There is a permanent irreversible dilatation of the bronchioles, and that is about the pathophysiology of whooping cough. We see the person inhales toxins, antigens, multiplication, and causing all of these pathological changes. Moving further to the last slide, to have a very clear understanding about whooping cough. Anytime anybody questions you about whooping cough, you know the causative factor, you know the pathology behind it, very clear in your minds. So we see how is the transmission. It is by the bacteria. Transmission of the bacteria is by the aerosols. We see droplet infection, and it will go and adhere to the ciliated epithelium. There is multiplication of the bacteria, increased in the secretion of mucus. Later it is causing the destruction of the ciliated epithelial cells, causing a paralysis of the epithelial cells, and the secretion of other toxins which are causing the other systematic reactions. Moving further to the clinical features of pertussis. Symptoms of whooping cough are runny nose, stuffy nose. We will discuss in detail all the stages. There are 3 stages in that. That is the catarrhal stage, paroxysmal stage, and convalescent stage. Before that, have a general knowledge what are the common signs and symptoms the patient comes up with is the runny nose, stuffy nose, fever, coughing fits, classic paroxysms of uncontrollable cough, which is violent and it is persistent. And then there is a high pitched intake of air producing a characteristic woof when inhaling after coughing. Patient may also come up with vomiting or broken ribs because of the excessive coughing. Such violent and persistent cough, the patient can end up with breaking his ribs. And struggling to breathe, there is apnea and cyanosis. So let us discuss in detail about each of the stages. The pertussis can be categorized into 3 stages. We have catarrhal, paroxysmal, and convalescent. Starting with catarrhal stage. Catarrhal stage will last up to 10 days. It is characterized by insidious onset of fever, rhinitis or stuffy nose, sneezing, anorexia. The patient loses the appetite. Loss of appetite can be observed. Nausea, vomiting, lacrimation, irritating cough at night. Okay, similar to this picture you can see and recall the symptoms of catarrhal stage. Catarrhal, what happens? In the eyes we have lacrimation. Catarrhal, right? So there is lacrimation. Sneezing, stuffy nose or coryza. Then we have anorexia, hacking cough, malaise, etc. Then what else did we see? Nausea, vomiting, irritating cough. Moving further, okay, we saw the pictures: fever, rhinitis, stuffy nose, loss of appetite, that is anorexia, nausea, vomiting. Moving further to the paroxysmal stage. The cough in paroxysms is accompanied by vomiting. Initially, there is cough followed by the vomiting. Sudden, deep, violent inspiration is producing this woof sound, and this woof sound is produced in paroxysmal stage. Ulcers are seen in the frenulum of the tongue. You can see the picture here. The ulcers which are found on the frenulum which connects the tongue to the floor of the oral cavity is the frenulum. The thin like a connection you can see, you can feel it. It is connecting the tongue to the floor of the oral cavity, the frenulum, and the ulcers are found on the frenulum of the tongue. There is sweating, congestion of the neck and scalp veins, suffocated with congested face with or without cyanosis. The patient can have congestion of the face with or without cyanosis. You can see the picture, the congested face in whooping cough with or without cyanosis, and the patient can also come up with subconjunctival hemorrhages, periorbital edema, and convulsions. So the paroxysmal stage, which is lasting for 2 to 4 weeks. So there is a burst of rapid consecutive coughs. This is very important. The cough is very rapid, consecutive coughs, paroxysmal cough, and this cough is accompanied by vomiting and the deep high pitched inspiration, the deep high pitched inspiration producing a characteristic woof, followed by the vomiting, then the cyanosis, apnea, persistent cough. All of this is very important in paroxysmal state. Paroxysms of cough, and cough followed by vomiting. And because of the intense cough, there is a congestion. Because of the intense intracranial pressure being increased, there is subconjunctival hemorrhages, periorbital edemas, convulsions, suffocated face with congested face with or without cyanosis. Habits pattern of coughing may be longer to several weeks and months in cases of convalescent stage. So in convalescent stage, which is lasting up to 1 to 2 weeks, the illness is generally lasting for 6 to 8 weeks or longer. Okay? Is it clear? What are the 3 stages we saw? The first stage, let me just zoom in. Yeah. The 3 stages, what are those? First stage was catarrhal stage. The catarrhal stage, what did we study under the catarrhal stage? It is lasting up to 10 days. The catarrhal stage lasts up to 10 days. There is lacrimation, sneezing, coryza. We saw about the hacking cough at night, diurnal cough. Okay, it's morning and at night, diurnal cough, anorexia, loss of appetite, and so on. Second, we saw the paroxysmal state. You're very clear. Whenever the paroxysmal stage comes up, you can write down the points very quickly. What are those? It lasting up to 2 to 4 weeks. It lasts up to 2 to 4 weeks, characterized by the paroxysms of cough, followed by the vomiting, high pitched inspiration, which is producing the woof, and so on. The cyanosis and all that parts you can add, apnea and everything. Now the third stage what we discussed was convalescent stage. Okay, under the convalescent stage, where the patient is coming back to a pre-healthy state. So in the convalescent stage, it is lasting generally up to 6 to 8 weeks, or it can last for few months. Moving further, to the differential diagnosis of whooping cough. Beginning with bronchiolitis. Bronchiolitis is a viral infection which is characterized by the inflammation of the bronchioles, causing severe dyspnea and wheezing. By the term itis, we know it is inflammation. Bronchiolitis is what? Inflammation of the bronchioles. And the inflammation of the bronchioles is producing dyspnea and wheezing. You can see bronchiolitis, lower respiratory tract infection, which is mainly affecting the infants and the young children under 2 years of age. The patient presents with the noisy breathing, shortness of the breath, vomiting after feeding. Baby will be irritable, nasal flaring can be observed, and whooping cough is also seen. Moving further to the other differential diagnosis, that is croup. The inflammation of the larynx and trachea in the children is the definition of croup. And croup is also associated with secondary bacterial infections which are causing the breathing difficulty. The patient presents with the hoarse and barking cough, nasal drainage, sore throat, fever, tachycardia, tachypnea, and inspiratory stridor in cases of croup. Clear, guys? Croup, what is the definition of croup? Croup is nothing but the inflammation of the larynx and trachea. The inflammation of larynx and trachea. Since the larynx, the voice box is involved, the patient presents with the sore throat, hoarse cough, barking cough, low grade fever, tachycardia, tachypnea. Moving further to the other differential diagnosis comes up with pneumonia. In pneumonia, there is inflammation of air sacs of one lung or both the lung, which may be filled with pus. The clinical presentation is in pneumonia, the patient presents with high fever, cough, sometimes it can be yellow, green, or bloody mucus. There is fatigue, rapid breathing, tachycardia, shortness of the breath, sweating, chills, chest pain, abdominal pain, loss of appetite, bluish skin, lips and nails, which is nothing but cyanosis, and altered consciousness, that is, we have confusion, altered mental state is also seen. Moving further, asthma. Asthma is a chronic inflammatory disease of the airway which is characterized by hyperresponsiveness, mucosal edema, and excessive mucus production. So we see that there is an inflammatory disease where there is excessive mucus production. So the patient produces dry cough for few weeks, followed by the cough producing the phlegm, shortness of the breath, frequent respiratory infections, cyanosis, tightness of the chest, and fatigue. Moving further to the complications of whooping cough. They are syncope. Syncope is the temporary loss of consciousness, or the layman language we can say faint. So that is the syncope. Medical term for faint is syncope. We have sleep disturbances, incontinence of urine, rib fractures because of the violent paroxysms of cough. They are persistent and very violent, resulting in the rib fractures. The complications which are seen among the infants are pneumonia. In 22% of the cases, the complication pneumonia is seen. Seizures is seen in 2% of the cases, and encephalopathy in more than 0.5% of the cases. Death. Infants, it is less than 0.5% of the cases we have encephalopathy. Very rarely the patient can end up into encephalopathy starting with whooping cough. It is a very lethal disease in cases of infants and children, so death is seen. Infants, particularly those who have not received a primary vaccination series, are at a greater risk for the complications and mortality. So those children who have not undergone the immunization, the non-immunized children, malnourished, immunosuppressed children, are those who have not got their vaccination done, are at a greater risk for the complications and death. Moving further to the investigations in cases of whooping cough. Complete blood count. We see the absolute lymphocytosis on CBC. ELISA, enzyme-linked immunosorbent assay. It is done to detect the IgA and IgG antibodies. The chest X-ray shows the perihilar infiltration. So the perihilar infiltration is seen in cases of whooping cough. Culture, the nasopharyngeal swab or aspiration from all the persons with the suspected cases. So we need to take the swab and perform the culture in all those who are having to be suspected with whooping cough. Direct fluorescent antibody test is done to detect the Bordetella pertussis antigen. The fluorescent antibody test is used to detect Bordetella pertussis antigen. Moving further to the control and prevention of whooping cough. It can be dealt as 3 phases of prevention. The primary prevention is mainly focusing on the cases and contacts. The secondary prevention, we have active immunization. Under the tertiary prevention, we will focus on the passive immunization. Beginning with the primary prevention, in cases and contacts, once a case or a contact is detected, we need to perform the early diagnosis, isolation, and the treatment of the cases. Also, disinfect the discharge from the nose and throat. They are the general principles for the control of whooping cough. The main thing, how can we control the whooping cough in cases we will do the quick diagnosis with the help of observing the signs and symptoms, making use of the required investigations if necessary. We will diagnose the case, isolate the patient, and give the required treatment. And also doing the disinfection of the discharges. It is the general principle for controlling of the whooping cough. The value of the fluorescent antibody technique, it is more emphasized in facilitating the rapid diagnosis of pertussis. If you want to perform a rapid diagnosis of the pertussis, the fluorescent antibody technique is used in cases of the pertussis. Antibody may prevent or moderate the clinical pertussis when given during the incubation period or catarrhal stage. So it is preventing the clinical presentation, prevent, or it will moderate. It will completely prevent or it will moderate the clinical pertussis. If you give it during the incubation period, the antibodies can prevent it, or also they will reduce the pertussis infection. Moving to the secondary prevention, the vaccine which is usually administered in the National Childhood Immunization Program is the combined vaccines like DPT, DTWP, or DTaP vaccine. For diphtheria, whooping cough, and tetanus, DPT vaccine is administered. So we see diphtheria, pertussis, and tetanus. For these diseases, DPT. D stands for diphtheria, P stands for pertussis or whooping cough, and tetanus vaccine is administered. Moving further to the DPT vaccine, how is it administered? It is given intramuscularly at 1 month interval starting at the age of 6 weeks. Okay, from 1 month we start the vaccine. At the age of 6 weeks, at 1 month interval starting at the age of 6 weeks, from the 1 month interval the DPT vaccine is given intramuscularly. What is the composition of the DTP vaccine? Diphtheria, pertussis, and tetanus vaccine. It contains acellular pertussis, diphtheria toxide, tetanus toxide, hepatitis B, and IPV. Moving further to the tertiary prevention. It is still an unresolved problem. Even if the level of the immunization is taken to 100%, it is possible that the disease wouldn't be entirely eliminated. It is a very important public health concern that even if the immunization coverage is 100%, it is still an unresolved problem, because the vaccine of the whooping cough have never been claimed to be more than 90% effective. Even though the vaccination coverage is there, but the effectiveness is just 90%. Okay, since the vaccine effectiveness is 90%, it is still a problem that the cases can still emerge. The merits of hyperimmune globin in pertussis has yet to be established. Thanks for watching. With this, we come to an end of the session. I hope whooping cough is clear. If you have any doubts, put them down in the comment section. And if you like the video, hit the like button and subscribe.